Well, I guess it's good afternoon now, so sorry about that. Good afternoon. As Gail noted, I'm Jackie Bowens, and I'm the president and CEO of the DC Hospital Association. And on behalf of our board, our team at DCHA, we would like to welcome you to this, our third Patient Safety and Quality Summit, and actually our first virtual summit. So welcome, and again, to our new normal. Even though we are virtual, I guarantee that it will be equally as informative and as engaging almost as what you've seen in the past. The team has done a fantastic job in bringing us all together. And so we're certainly excited to do this Patient Safety Summit virtually. We're also very glad that you joined us this week, which also happens to be Healthcare Quality Week, and give us an opportunity to explore how you're thinking beyond the barriers and how we can deliver better outcomes in the experience and safety of our patients. We're happy to host this event with our sponsors, featuring a variety of health experts and our talented peers on clinical effectiveness, population health, patient safety, and service excellence. We also get to celebrate winners of our inaugural poster competition and award individuals for their excellence. Again, I'd like to thank the leadership of DCHA. I want to give particular thanks to the team, under Gail's leadership, Gail, Julie, Eden, Annette. I know I'm leaving somebody else out, so if I apologize in advance if I forgot someone. That's always the danger. But again, Elizabeth, Eden, and Julie and Gail, thank you so much for all of your hard work. We are also very proud to highlight the great work of our hospital association community. I thank you again, and I hope that you very much enjoy today's summit, day one actually, and I want to turn it back over to Gail, who will introduce our first session.
Thank you, Jackie. We have a great lineup of sessions today to kick off day one of our summit. We'll first hear a session on resilience, followed by an awards presentation at 1 p.m. I'm pleased to announce that the newly relaunched DC Organization of Nurse Executives, 1DC, is serving as co-leader of the summit and is a key contributor for our first session. For those who are not aware, 1DC is a nonprofit organization supported by DCHA, with the goal of supporting and developing nurse leaders and nurses aspiring to be leaders. This includes nurses from all settings and specialties who hold positions as nurse executives, administrators, managers, educators, quality managers, nursing staff, researchers, as well as those we mentioned, nurses who are aspiring to be leaders from across the district. The organization is DC's chapter of the American Organization of Nurse Leaders, which aims to address nursing workforce administration, education, evidence-based practice, research, health policy, and professional practice issues. 1DC is open to licensed nurses at any level who are employed by a DC hospital, as well as students and faculty at DC schools of nursing and other nurses serving in the healthcare community throughout the district. As a newly relaunched chapter, there are great opportunities to gain leadership experience and learn from your nursing colleagues. I encourage you to follow the link on our screen for more information. That said, it's my pleasure to welcome 1DC President Denise Boehm to present on nurse resiliency, the value of real-time stress reduction. Denise was named Associate Director for Patient Care Service and Chief Nursing Executive of the Washington, D.C. VA Medical Center in September of 2017. She served in various professional organizations, including local chapters of the American Nurses Association and the American Association of Critical Care Nurses, where she coordinated education and community support events. She earned a Bachelor of Science degree in nursing and a Master's of Science degree in nursing leadership and continuing nursing leadership and education from Carlow University in Pittsburgh. Welcome, Denise.
Hi, good afternoon. Thank you for that, Gail. And thank you for mentioning the 1DC. It has been really a lot of work and support by the DCHA and helping us get to where we are today. And it's really an important collaboration. So thank you for taking the time to mention. And please, everyone who is listening today, if you can please speak with those in your facility to encourage your either current nurse leaders or aspiring nurse leaders to join, we would appreciate that. So with that, I am going to share my screen. So bear with me. I want to make sure that you can see the slides. Are you able to see my slides?
I'm not.
We'll
Julie,
give it a moment. I think I've done it correctly.
okay, it looks like Julie has shared for you, and you can just tell her
Thank
next
you.
slide when you're ready to move on.
Perfect. Thank you, Julie. So I thought that it was important to take a pause and have a discussion, especially in our current climate, to talk about stress reduction, both for us as leaders and for our staff. So if you could go to the next slide, please. Next slide. So some of the things that I wanted to talk about today is how do we manage the stress we see in the people we lead? What do we do when we recognize that stress in ourselves? And give some time at the end for further reflection, maybe sharing some stories and answering any questions that we might have. Next slide. So when we talk about leading others through stress and thinking back, 2020 was the year, or continues to be the year, of the nurse and the midwife. And thinking about all that we have been through as nurses and healthcare providers in 2020 thus far, it has been quite a stressful year. So I wanted to spend some time talking about how practice changes have defined this year, how resiliency and flexibility have become part of, if not the most important key competencies we have had as healthcare providers. I wanted to spend some time and talk about burnout and also moral distress and how we handle that. Next slide. So starting first with practice changes, this has been a very challenging year for healthcare providers. And when we think about all of the changes that we've had to incorporate in our daily practice, it has been just fraught with change. And these changes initially, and still for some may be, very stressful. So when we think about all of the changes, they may have been perceived as threats. They may have invoked fear. There may have been an introduction of new technology and ways of doing business that we've never dealt with before. And it may have led to isolation, both professional and personal. So I'm going to talk about each of those in a little more detail, really focusing on the changes that we have experienced and how they've impacted our practice. So when we think about the things that could have been perceived as threats, the way we were looking to do business in terms of care provision in 2020 with the COVID pandemic could have felt like an increase in work, not only because of the increased PPE requirement, but the perception of long hours, maybe less rest between shifts, and also a threat to livelihood for some of our fellow coworkers. Conversely, there also was work reduction. So if you think through and reflect back on everything that we have done in terms of COVID and our mitigation strategies, one of the very first things that we as healthcare providers were asked to do was to look at what was absolutely necessary, what was essential. What are those things that we had to continue? And what are those things that we could put on hold when it was safer to reintroduce care back to face-to-face types of strategies? So from that respect, it was actually, in some instances, a work reduction because we eliminated non-essential face-to-face visits and shifted as many visits as we could to telehealth or other modalities. We diminished surgical cases and procedures unless they were urgent or life-threatening. And we looked at what other telework or telehealth modalities were available. So, there was both an increase and a work reduction. There was a lot of fear as well, fear of the unknown, as this was something new that none of us as healthcare workers had ever experienced. So we were looking at how is this going to impact us? What are the long-term effects? How are we going to educate one another and take care of one another? Is there going to be enough PPE? And also fear in terms of staff redeployment. And by that, I mean, as we as healthcare providers work to ensure safety of one another and safety of those we were providing care to, it became necessary in some cases to shift our resources. So I mentioned a few moments ago that work was shifted from unnecessary face-to-face visits to telehealth. There may have been a redeployment of staff from those work areas to support inpatient care. And again, with that was the fear of the unknown. How can we do this safely? How can we educate one another? And what can we do to provide ongoing support? There was also a fear of supply availability. As we as a nation were going through such tremendous change very quickly, there became a sudden surge for certain items with everyone needing large quantities at the same amount of time. And so with that, what were the strategies that we had to implement locally to make sure that we were going to keep our staff safe as well as have what we needed when we needed it? So that was a big fear for staff. Thinking through new technology. Some of us are fortunate that we have had telehealth modalities very prevalent in our systems for a long time. But there are some who were not that fortunate. And so again, this was something that could have been perceived as a fear because now there was the incorporation of telehealth. With that also came some unique challenges where bandwidth availability could have been a challenge. And also looking at staff who can work remotely and how can we do that safely and still meet all of our needs. And then the fear and potential impact of isolation. This became very challenging, in particular for healthcare providers, in that there was both a professional and personal impact. For those of us that were in the midst of providing care to those affected with COVID, some chose to isolate so as to not put others at risk. So this became very, very challenging for staff. From the professional side, there was further isolation given that visiting hours were greatly reduced if allowed at all, in our healthcare facilities, which became a very challenging thing for staff who have become accustomed to incorporating not just the patient into their plan of care, but their entire family into the plan of care. So without that additional support, there was even more stress on our healthcare providers. Next slide, please. So that brings us to burnout. The definition of burnout is a feeling of overwhelming exhaustion, cynicism, and low self-efficacy that results from work strain. And we have had one heck of a go of work strain over the past 6 to 8 months. The impact could lead to job dissatisfaction. It could lead to turnover. It could have a very serious emotional and physical toll on our workforce. And when we're not working at our best, there becomes a concern for adverse patient outcomes. There could be more errors. There could be gaps in communication. There could be a decrease in quality of care and a decrease in patient safety. So our dial, how we are tuned into our predisposition for failure may be very diminished. And with that, it could lead to not only negative impact to staff, but negative impact to patient care. So burnout is something real that we really have to, as leaders, pay attention to when we start to see these signs of exhaustion in our staff. Next slide. Moral distress. Moral distress, especially in times like this, can come from knowing what we should be doing, but we're not able to do it because there are some constraints that could be external constraints, or they can be within us, but it challenges our integrity and the well-being of those that are providing care. And this directly links to burnout. If there's moral distress, there is likely an increase in the exhaustion of our healthcare workers. And again, moral distress could not only negatively impact the staff, it could lead to moral injury, and this could be significantly challenging to caregivers. Just reflecting on the past several months and the impact of moral distress, I can give a couple of examples of when there was either a real or perceived moral distress. In thinking through the early stages of planning for the COVID pandemic, there were work groups developed to look at scarce resources. Even just thinking through the allocation process of if it becomes a real factor of limited resources, how would we prioritize? Just the conversations alone and the decision making for these resource allocations had led to some moral distress in caregivers, trying to determine who is going to get a ventilator, for example, when resources are limited, who would get PPE if resources are limited. These are discussions that were necessary, but were very, very difficult for caregivers to have, that really contributed to moral distress. Another real example of how moral distress directly impacted caregivers had to do with the isolation impact on those that are receiving care. Thinking back through this COVID pandemic and when the DC metro area was at its peak, our hospitals very quickly became very full, and the acuity levels went very high very quickly. And with that, there were patients either with COVID or otherwise who were in very critical condition and subsequently passing who could not have their families at the bedside. For a healthcare worker, this is counter to all that we've done in the past several years with incorporating family through all of the phases of a patient's healthcare journey to include end-of-life care. Now, in the middle of the pandemic, we were the only people with these patients at the end of life, and that caused a lot of distress as caregivers were now either trying to Skype with family or have them on the phone, but knowing that they couldn't be there with their loved ones was very challenging and very distressing for our healthcare providers. Next slide. So what can we do and what should we do as leaders to help our staff get through these challenges? One recommendation is to create a task force. Look at the staff who are available and willing to tackle these problems and work as leaders at the bedside to support their peers. Make the top facility leadership accessible, whether it's through leadership rounds or town hall meetings, whether in person or virtual. Having accessibility to leadership, showing that leadership is supporting the staff through these challenging times, goes a long way. Safely and methodically redeploying bench staff. So giving people a break, cycling them in and out, making sure that they have adequate rest will keep them fresh and allow them to kind of recharge and regenerate. Create a culture of transparent communication. So again, through rounding, virtual town halls, virtual staff meetings, however we can use the technology to our advantage, it is helpful. And foster well-being. Next slide. So one of the things before I move on to talking about how we can take care of ourselves as leaders through these challenges is considering all of the resources that are available to our staff, whether that be through employee assistance type programs, development of an in-house critical incident stress management team that can be available just to listen, whether it's individually or with a group that is working together frequently. Those types of resources go a long way to the well-being and preservation of staff morale. So I'm going to move on to talk a little bit about how can we take care of ourselves as leaders. Because typically as leaders, especially those in a healthcare setting, we're very focused on our staff. We are very focused on our patient population. But at least my experience is me personally, and if other leaders are like me, the priority for self-care falls to the bottom after all of those other groups are taken care of. So I want to talk about some strategies to take care of ourselves as leaders. So it's important to recognize our own stress. And I'm going to talk about examples of how this stress can flow in both directions, uphill and downhill, and what we can do to counteract the stress. Next slide. Okay, so some of the things that I've incorporated into this portion of the presentation are tools that will be available to you afterwards if you would like to use them either for yourself or with your teams. But this tool is a life balance wheel, and it allows you to kind of rate what you think or how you think you're doing, how satisfied you are in each of these areas. So there are really no wrong answers, but think about if everything was a 10, how would you feel in those areas? So for example, if you're putting body and health as a 3, why is it a 3 and what would it look like if it were a 10? If you are putting recreation and creativity as a 1, why is it currently a 1, and what would it look like if it were a 10? So 10 is the ideal state. And while it's not likely feasible to have a 10 in every area all the time, it gets us to think about what is that ideal state and what circumstances need to be present in order to get from a 1 to a 10 in each of these segments that compose us as a whole human being. Okay, next slide. I wanted to incorporate some tools to include some very easy to read guides for managing stress. So this is an example of a very easy read that gives some real-time tips on managing stress. It focuses not so much on time management, but getting the most out of our energy. I think it's fair to say as leaders, we've all experienced those high energy days versus the low energy days. And how do we feel in one versus the other? What can we do to maximize those high energy days, and what is different about them? This book helps crosswalk that in order to make the most of how we're feeling. It also stresses time off. I think that's another thing that a lot of leaders aren't the greatest at. Um, Taking time off and really being off, disconnecting, so that you can truly regenerate. It talks about positive intelligence and identifies some tools to develop a plan for when you feel overwhelmed, which is actually a very useful tip to have a couple of strategies ready to go, where if you're extremely overwhelmed, you can pull them out of the hat and know what you would need to do to refocus and then readjust your productivity accordingly. Next slide. So it's important as leaders that you really manage your energy, not your time, because this will lead to exhaustion otherwise. Something that is really important to understand is that time is limited, but your personal energy is renewable. But in order to renew that personal energy, you have to be able to spend some time doing something that you enjoy that is not work related, so that you can refresh and refocus. Spending longer days at work and um, maybe accomplishing your goal and maybe not isn't necessarily going to get us to the end result if the end result means that we become disengaged and exhausted. So it's really, this concept is one that I find very helpful. Simple rituals to help us replenish, whether it is going for a walk, whether it is meditation, whatever that may be for you. It's important to do that so that you can stay fresh and therefore be a better leader for your team. What we don't want to see are leaders that end up having an energy crisis and are subsequently not able to perform the way that they intend to. Next slide. So the concept of making time off predictable. We don't want to get to a point where we are completely drained as leaders before we take time off. So I say this because we should have regular intervals where we are recharging our batteries, taking care of ourselves. Therefore, we can take care of others. So a lot of times in our roles, we are expected to be available 24/7. And while that may not seem unrealistic, there does come a time where we have to recharge. So we should be able to and give ourselves permission to unplug for vacations and schedule that time that we need. And if possible, find a buddy system so that at times, if it's appropriate, some responsibilities can be shared. Next slide. Okay, the concept of positive intelligence was introduced, so I want to talk a little bit more about that. In stressful situations, we end up at times reacting, and because of that, we overactivate and overstimulate our fear processor in our brain, and it steals resources. We become very reactionary, very stressed, and we don't work in terms of positive thoughts and positive intelligence. We work in terms of reaction to the current situation. In order to best use our positive energy and positive intelligence, what would be helpful is to engage positively, and also in our social network and with our coworkers, so that we can respond instead of react. This will help us change our attitude towards stress. So one of the things that can be helpful here is to do a list instead of it being a pro-con list. It's similar in that you can make a list of things that create stress in terms of what is under your control and what is not under your control. So when you start to realize that the things that are under your control are things that can impact you positively versus the things that are not under your control, which will impact you negatively, then you can begin more of succinct process to manage that situation. And if you think this through, you can do it in just about any situation that you are working through or leading through by developing this same type of list. What within that situation is completely within your control? What can you affect as a leader positively? And what is outside of your control or your sphere of influence that you may not be able to work through, or you may not be able to have complete control of? Oftentimes as leaders, we tend to spend the most time and the most energy on the things that are completely outside of our control. And that is a big energy drag from us. Whereas if we can shift that mindset and focus on the things that we can control and can influence, we may have better outcomes. Next slide. This is another tip, a practical plan for when you feel overwhelmed. Again, I am a fan of lists and writing things down, because if I see it and I write it, I am more likely to accomplish it. So if you write everything down that you have to do, then you can spend 15 minutes doing the do it now. So the things that are very easy to complete, just get them done and then scratching them off your list. Then what I like to do is work on the most daunting tasks for the next 35 minutes. Again, maybe they can be accomplished, or maybe they need further development, or they need some sort of plan to get done, but at least you have thought about them, they are on your list, and there is a plan to get them completed. And then you can take a break and come back to it when you have time. Next slide. So with that, I now have some points for discussion. I wanted to share some thoughts with the group and maybe even get some feedback from the group on how you've helped your staff manage the stress of caring for very ill COVID patients. I included veterans in my discussion, but it can really be anybody. How have you helped families manage during this time? And what have you done to manage your personal stress through this time. So I've shared some examples within my presentation. I have others that I can talk about, but I thought it might be nice to hear some examples from those on the call today.
Thanks, Denise. We do have a few minutes for questions from the audience and discussion. I'd encourage folks, just type in the chat if you have something that you've done, nurses or not. It's interesting, as you were speaking, I was actually sort of thinking, we talk about resiliency in relation to clinical care providers and nurses, but it seems that these days, it, as you pointed out, applies to families and ourselves as well. So I'd be interested in hearing people just sort of quick typing, you know, some of the things that they do. In fact, one of the things that you pointed out in your sort of idea of a checklist or sort of figuring out how to tackle things is one of the things that I personally have done as well. It helps me to sort of keep myself organized and stay centered, to sort of think through what's my goal, how am I doing on that, to sort of see progress, just my own personal way.
Absolutely.
So folks can just type in the chat any little thoughts or quick things that you've done, either for yourself, for your families, or with your staff. It's interesting too, as I was thinking through, listening to your talk and thinking through some of the presentations we've had in the past on resilience and burnout. We even had one at last year's summit, a whole session on that. And of course, I don't recall it including the critical components that now have come out around fear. And you talked about that a fair amount,
Yeah.
and we've certainly seen and heard it throughout this, you know, and not just with nurses, but sort of the general public. But certainly now we are in a time where that adds uncertainty, and that additional uncertainty, whether it's fear or anxiety, you know, sort of whatever the term is that you assign to it, it sort of heightens that and can potentially contribute to more. So I'm curious, what do you have a sense for what nurses have found most helpful to address those kinds of things uniquely?
I do, and I can tell you that in looking at the questions and to incorporate into your question, there have been a couple of things from my experience that have been very helpful. And those things have been peer groups, peer support groups that are facilitated either by a psychologist or a chaplain or someone that has some experience, and just allowing people to talk through what they're feeling. We initiated those during the peak of COVID, but they're still going on today because there's just so much that people want to talk about. It has been tremendously useful. And I saw a comment pop up about dogs. It's an interesting comment, but that is something else that has been very helpful because we do have pet therapy within our facility, and we opened that up to the staff, which has really been helpful for the staff to just allow them a moment with the therapy animals has really been powerful. So the two of those, I think, have been the most helpful.
That's interesting you say that. When I saw that comment in the chat, I was actually thinking to myself, I have a cat, and once I managed to get the cat like up to share on video when we were doing one of these things, because cats aren't as cooperative about being held as dogs. But you see it like throughout, not just in your own things, but you see people sort of sharing their, you know, their pets just as part of, you know, their work if they're able to do so, which has been really interesting. I have another comment, actually. They didn't comment in the chat, but they did in the Q&A, so I wanted to share it because it was along the same lines of sort of what of something that you've done. And this person said that they've worked on personal development, taking a nurse legal class, and recently got chemo certified. So you're taking a moment to have a moment to say, all right, what do I want to do from a professional personal development standpoint? I think that's a really great one because it allows you an opportunity for positive, you know, positive steps forward.
Absolutely.
Yeah, that's really great.
I also saw a question about whether or not we could offer something regarding stress reduction through 1DC, and I think the answer to that is yes. I think now more than ever, it's very beneficial for people to build this toolbox, and I'd be happy to offer something as a presentation or even a real-time demonstration through 1DC.
That sounds great. Yeah, one of the other things we've been working on in collaboration with a couple of folks on the city side is thinking about how we can provide education and support for nursing students as they are,
Mm-hmm.
you know, for a while, nursing students were going into the hospitals, was sort of like freeze everything. And now as we're figuring out how to get residents and nursing students back in, thinking through what might they need to know that would be a little different than what they might have before in terms of preparing them for some of the stresses that are sort of even more potentially extreme. And we're working on getting ready to roll that out in collaboration with 1DC to be able to provide some funding to do some education specifically around those kinds of things. You know, tactics to manage if you're, you know, working in the hospital and then you have to go home and, you know, you're worried about exposure and how you might
Right.
use those. So that's another way that I think we're going to be able to collaborate with 1DC ourselves on doing that.
Thank you.
The other thing I think that's interesting that came in on the Q&A as opposed to the comments is a question I'm not sure if I have the answer for it, and maybe it's more of the same, but someone was sort of saying that, you know, the pandemic may actually continue a little more long-term than we all hope. And what might be some long-term strategies for resilience as opposed to shorter term? And is there a difference? What do you think about that?
Yeah, I think that we do have to think about long-term stress reduction strategies. And I think that is the reason why our peer groups and our critical incident stress management teams, at least from my experience and what I have seen, are continuing. Because it's not something that has been transient and has gone away. This is something that we are now preparing for a longer term course of action. And so I think that having those resources available for our staff, destigmatizing them as well, making sure that everybody understands that it's important for the staff to have resources available to take care of themselves, because this is going to be something, unfortunately, that is going to be around for a while. So I think that the peer groups, any kind of stress management classes, wellness, you know, offering wellness activities such as Tai Chi, yoga, massage, all of those wellness activities that if we have the resources we can make available to our staff are going to go a long way in helping minimize the burnout and the moral distress.
I think that's a good point. And again, you know, sort of taking, as I see things and I'm connecting to my own thing, you can do some of those things virtually too. So you can do,
Yes.
I've seen a lot of virtual yoga, Tai Chi and Pilates kinds of classes that are around centering, but doesn't require you to be in a big room with a whole bunch of other people breathing each other's air.
Right, right.
That still gives you an opportunity to sort of connect. So that's something that I know people had talked about. Some of our hospitals even had some, you know, sort of calming rooms and other kinds of wellness activities, but those are things that you can even do virtually and remotely, which I think also bodes well for sort of longer term is doing that. And so many health benefits from them beyond just the reduction of stress. Somebody actually said, you know, what's in place specifically to prevent burnout? You know, so do you have some thoughts about things, how you connect the dots from sort of reducing your stress to preventing burnout? A little more on some of the tools you have there?
Yeah, I think a lot of it really depends on the leaders in the facility and having good open communication with the staff. Because without that, then you lose the ability to recognize when the staff are starting to have some challenges with how they're dealing with this. So I think communication with staff is key. Getting out and doing rounds, whether they're virtual or in person, having the ability to recognize and talk with the frontline staff and the first and second level supervisors, I think is a key to that, so that we not only recognize but intervene before things begin to escalate. I don't know if that answered the question.
I think it was a good start. Yeah, because it talked about sort of how do we take that next step? So we've reduced stress. What's the next step, right? And I think it's a good point. Leadership support is so critical to that. And I'm thinking about what you said regarding sort of permission to unplug, right? For a while there, it was sort of like, who would have even dreamed of taking a day off?
Right.
Whether working for some of us remotely or not, we were working, multiple long days, and either in the organization providing care, or even virtually, sometimes just we call it the Zoom tunnel. You're like that,
Right.
meetings for like 12 hours a day. And it's interesting because, thinking that, you have to take a moment to like take a breath and think, and that in fact, we need to think about how to build in those breaks and how to ask for those breaks when we need them, and have the support to be able to feel like we can ask for them.
Absolutely.
That without that, you can reduce the stress, but you're going to still run into issues with burnout if you're not able to sort of take next steps. So that's a really good point. In fact, it had to have been over a decade ago. I won't date myself and say how long ago I think it was. I remember reading one of the earlier articles that came out around cardiovascular health, and it was actually a European study done in Sweden, I believe, that was actually more just general workplace connected to health. And what they found was the more control individuals had over their work and their environment within their work, the less cardiovascular complications that they had, and the less control they had, the more cardiovascular. And it was sort of one of those first studies that came out on that. And I think that, these days, that is one thing that, maybe we had a little bit of it, and then all of a sudden we, potentially
right.
lost half of that, just because of need. There's another interesting question that I'll throw your way, and maybe we can see if folks have some thoughts on the chat too. Are there specific ways families can support nurses and other clinical staff? And, either ideas if I'm a person who has somebody like that in my family, or that I could ask for if I'm a nurse and I'm going home and I need to say, hey, this might actually be really helpful for me. Any thoughts on how families can support nurses and other clinical staff?
Yeah, this has been really a tough one for a lot of reasons. One, because there were so many healthcare workers who chose to self-isolate. But I think that just asking a question and talking it through, it might be different for everyone, but maybe dropping off a home-cooked meal somewhere, or putting together a group within a community of people in similar situations, because you may not know that your neighbor is going through something that is a similar situation to yours. I think it's tough for the families. I think it's tough for those that are providing healthcare, as well as those that are receiving healthcare. I think that's been one of the biggest causes of stress for a lot of our staff and a lot of our patients throughout this pandemic.
Yeah,
I don't know that there's really a good answer, but talking about it, I think, is the good first step.
yeah. Well, and that harkens back to some of the basic things we learned about managing trauma, and even PTSD is,
Right.
The criticality of being able to talk about it in a way that's sort of just getting it out there so that you can process it. The other thing that I heard someone mention the other day was they didn't have to worry about, I suppose on some level, spreading it to their family, because they live in a small studio apartment by themselves, but that meant they were work, go home,
Right.
in the apartment by themselves with, no interaction, because they were trying to be really good about not getting out and about. And the thing they said saved them was family virtual brunches. And, they took advantage of accounts like Zoom that you can get really cheap,
Right.
free, or even FaceTime to do like brunches and things, where they got to be able to make that social connection, even though it wasn't in person, and how critical that was for them to have a few of those, even if they were just short. And how, when they paused, because everyone was sort of like, oh, things are moving into phase 2 and maybe things are okay, that they actually missed them and reached out to their family members and said, hey, can we do a little more of this? I actually need that interaction. So even virtual interactions, at least anecdotally from some folks, is something that's helpful.
Absolutely.
Yeah, for sure. We've got a couple of more. I'm just going to look through and make sure I'm not missing any other questions. See if anybody packs any others in there. I think that's actually most of what we've got from the audience. So I'm so excited that you were able to share this with us. And it's interesting because we brought it up in context of nursing, and certainly it impacts nursing, but as it's pointed out here, it impacts family, it impacts sort of any line
Everybody.
of work. Yeah, for sure. Well, thank you so much for joining us today. I will take a moment here to remind folks, if you are a nurse and you're interested in connecting with other nurse colleagues, developing your leadership skills, or networking around nurse leadership, to check out that OneDC website. You can connect with folks like Denise and maybe share some ideas about how we can actually, collectively move some of this activity forward, particularly in light of that that educational grant opportunity that I mentioned. I think we'll have some opportunities to actually support with OneDC some education and training for nursing students and others in that area, which I think will be really great. So thank you so much for.
Thank you. Thank you for having me.
For those of us who are on the line, a couple of quick reminders and announcements.